Baking soda, a potential aid in slowing CKD progression. Chronic kidney disease, CKD, is a progressive condition characterized by a gradual decline in kidney function. As the kidneys become less able to filter waste products from the blood, it can lead to a buildup of toxins and a host of health complications. While there is no cure for CKD, there are treatments that can help manage the condition and delay its progression. In recent years, there has been growing interest in the potential of baking soda, also known as sodium bicarbonate, to improve kidney health and slow the progression of CKD. Baking soda is a common household ingredient with a long history of use in cooking, cleaning, and various medicinal applications. Potential benefits of baking soda for CKD. Several studies have investigated the potential benefits of baking soda for CKD patients. The proposed mechanisms by which baking soda may exert its beneficial effects include reducing acidosis. CKD often leads to metabolic acidosis, a condition characterized by excessive acidity in the blood. Baking soda as an alkali can help neutralize this acidity, potentially improving kidney function. Slowing CKD progression. Some studies suggest that baking soda may slow the progression of CKD by reducing inflammation and oxidative stress, which contribute to kidney damage. Improving nutrient absorption. Baking soda may aid in the absorption of certain nutrients, such as calcium and phosphorus, which are essential for kidney health. Reducing bone loss. CKD can increase the risk of bone loss. Baking soda, by increasing calcium levels in the blood, may help reduce bone loss. Research findings. While the evidence is not yet conclusive, some studies have shown promising results regarding the potential benefits of baking soda for CKD. A study published in the journal Nephrology Dialysis Transplantation found that baking soda slowed the decline in glomerular filtration rate, GFR, a measure of kidney function, by 1 milliliter min per year compared with an untreated control group that experienced a decline of 2.5 milliliters min per year. Another study published in the journal Kidney International reported that baking soda reduced the amount of protein lost in the urine, a significant risk factor for kidney failure, by 30%. A randomized controlled trial published in the American Journal of Kidney Diseases found that baking soda supplementation improved nutritional status and slowed the progression of CKD. Considerations for kidney patients. Despite promising research findings, it's important to exercise caution when considering baking soda for CKD management. Here are some key considerations. Consult a doctor. Before starting baking soda supplementation, it is crucial to consult with a doctor. They can assess your individual health conditions, medications, and overall kidney function to determine if baking soda is appropriate for you. Dosage and frequency. The appropriate dosage and frequency of baking soda supplementation for CKD patients should be determined by a healthcare professional. They can provide personalized guidance based on your specific needs. Monitor blood levels. Regular monitoring of blood sodium, potassium, and bicarbonate levels is essential while taking baking soda supplements. This ensures that these electrolytes remain within safe ranges. Overall sodium intake. Kidney patients should monitor their overall sodium intake, as excessive sodium consumption can worsen kidney function. Baking soda is high in sodium, so it's important to balance its intake with other dietary sources. Conclusion: baking soda has emerged as a potential therapeutic agent for slowing the progression of chronic kidney disease. Studies have shown its ability to reduce acidity, slow CKD progression, improve nutrient absorption, and reduce bone loss. However, it's essential to consult with a doctor before using baking soda, as it can interact with certain medications and may not be suitable for all individuals. Further research is needed to establish clear guidelines for its use and long-term safety in CKD patients.